I would like to share with the experience from Klaipėda University Hospital, Dr. Jasenas. Please welcome. Nice to meet you. He will talk about robotic-assisted vertical prostatectomy with Senhance platform. So please, doctor, share with your experience.
Good morning, everyone. Greetings from Klaipėda. I want to represent you our experience in Klaipėda University Hospital, robotic-assisted radical prostatectomy with Senhance platform. Urologist R.Venckus and Titas Telksnys helped me to prepare this presentation. In Europe, Senhance robotic system was approved 5 years ago for general colorectal surgery, gynecology, urology, thoracic surgery, FDA approved in 2018. First robotic assisted radical prostatectomy with Senhance platform was started 2018 in November, and total 200 robotic assisted prostatectomy until this year. All operations were performed by 2 surgeons. Our first data was published in 2019 in Journal of Robotic Surgery. It was our first cases in colectomy, pyeloplasty, pyelolithotomy, nephrectomy, but mostly radical prostatectomy. The second one was in last year, was published in World Journal of Urology. It was our 127 cases. And how we include patient in the radical prostatectomy. Patient inclusion criteria are the same as for laparoscopy radical prostatectomy. Good Gulf American Association of Anesthesiologists score below 3, with man body mass index below 40. A patient with previous abdominal surgery will also include. Surgical technique is selected by assessing the initial PCR level, the MRI data, histopathological examination after systemic or adaptive biopsy. Standard pelvic lymph node dissection, obturator, internal or external iliac, was performed in all patients with a lymph node metastasis risk of 5 or higher, according Memorial Sloan Kettering Cancer Center mammograms. Age of patient below 75, and patient agreements with this method of surgery. Operation technique is very similar, like in laparoscopy, but we just put 4 trocars on sample radical prostatectomy by vesical space, and just one trocar, 10 millimeters for assistant. And if I do lymph node dissection by transabdominal way, I put 1 5 millimeter trocars to easier put lymph nodes below umbilicus on the middle of abdomen, like an urostomy way. We use 3 robotic arms and sitting position on the right side. We use 3D glasses and our results. Below you can see our results last year, 127 cases, and up there you can see 200 cases. Age is similar, 62 years, body mass index 26. We say before radical prostatectomy 5.9, and CT stage before radical prostatectomy CT1C about 30%, mostly CT2 about 60%, and CT3 11. 1 year ago, had more cases with CT1C and a little bit less with CT A, B, C. And positive core biopsy number medium is about 4, and B biopsy Gleason score before prostatectomy about 50% Gleason 6, Gleason 7 about 40, and Gleason 8 or more 7.5. And PT stage after radical prostatectomy, PT2, most of them 82%, PT3A 12, and PT3B 5.5. Big difference in Gleason score. Gleason 6 left just 20%, it was about 55, and Gleason 7 about 75%. And Gleason 8 about 5.5. We can see last year we had a little bit less cases in Gleason 7, and I think in the last year we had a lot of patients with higher PSA level and Gleason score. Lymph node dissections about 24%. We had before just 6. And near sparing is similar, about 30%, and mostly one-sided, 22%. And nodes removed about 10. Before was about 8. Which means more and more lymph nodes were removed every year. And positive lymph nodes about 17%. In this slide, I want to show you what every year we more and more perform lymph node dissections. When we started, it was just a few cases because too difficult for beginner to perform bigger procedure with different steps. And the near sparing cases is similar last year and this year, about 30%. Overall time about 2 hours and half. That means sample radical prostatectomy and lymph node dissection. Radical prostatectomy sample takes about 2 hours. Lymph node dissections about 3 hours, 3 hours well. Depends on the patient. Estimated blood transfusion about 2 hours, 250 millimeters. Positive margins still a high number of patients, about 52. Was about 54. And mostly of them is PT3, more than 60%. Here you can see estimated blood transfusion is after 100 operation is still the same, about 250. When we start, you can see on the right side, it was about 40-50 millimeters. Here you can see overall time. It's also still the same after 50 operation varying curve, and still about 2 hours, 2 hour half for sample radical prostatectomy, and 3 hours half for lymph node dissections. And when we start, our overall time was more than 3 hours. And the complication, no complication about 88%, and mostly of complications is transfusions. Subcutaneous emphysema was our first cases without additional treatment, and we had a few strictures, lymphocyl, urinary blood injury. After that, we need after a few days to put laparoscopy and to perform a suture. And anastomotic leakage, we had a good choice to how to decide leakage. We put ureter catheter, both left and right ureter to the kidney, and left for 5 days, and this is enough, and you don't need additional treatment. And the conversation, we had just one conversation to open surgery and few conversation to laparoscopy, but some steps in to laparoscopy we do often when we need to perform some difficult steps, but we use the same trokers. Sometimes we need to put additional trokers to help perform some steps, but really enough 4 or 5 chokers. And conclusions, Senhance robotic system allows to safely perform radical prostatectomy with good functional outcomes. Low operating costs allow medical institutions to more widely implement radical robotic prostatectomy in their hospitals. The acquisitions of new technology for operating urologists is easy and safe to master. The introduction of new robotic operating system into the daily practice of urologists allows to reduce the cost of operations, increase the availability of robotic operating systems for surgeons. Thank you.
Thank you very much for your presentation. I would like to ask about timing, operation timing, from the beginning when you start do this procedure and now, how are you doing?
Our first cases takes about, my first case was 4 hours and 10 minutes, and now it's about 2 hours sample radical prostatectomies. But the learning curve is really short. If you are good laparoscopist before, I think need 20, 30 cases radical prostatectomy robotic, and after that you can do easy like in laparoscopy.
Thank you. Thank you very much.